I'd like to introduce Dr. DeMio, and we're going to be talking about Lyme disease and autism. Welcome, Dr. DeMio.
Hi, Kristen. Good to talk to you.
I'm really excited to talk to you about this because, we see the correlation. We hear so many families talking about Lyme disease and autism. But before we start, I think it's important for those that might not know who you are, which I can't imagine people not knowing who you are in the autism world, but for those that don't know who you are, I would love to, give them a little bit of your background of, what you do, and then also why you're so passionate about what you do.
Well, I really think the important driving force of what I do is a response to what we see, and that is this ongoing, ever-expanding epidemic of autism. We have autism in small children, sometimes under 1 year old. We've seen several cases of that, and the parents knew something was wrong, and no one will recognize and acknowledge it till they really help us with the drive to do something about it. So it's really based on the parents and the children's needs. And then we also see an ever-increasing number of young adults and some older people who are entering and who have been in the realm of autism as adults. So the passion is that there's a big need out there, but I think Kristen, I never saw a case of autism, having been out of medical school for many years, until my son came along and developed a severe regressive case of autism. And it followed his vaccinations, and I didn't diagnose him with that sequence, but many doctors he's seen are aware of that sequence and have diagnosed him with that. And so that just caused me to really try to help him, and I found very little help out there for my wife and for my son and for our family to help him. And I did learn about people through Autism Research Institute and Dr. Bernard Rimland, who's from Cleveland, a mile and a half away from where my father was born. They didn't know each other, but they were in next neighborhoods to each other, and it was really a real odyssey. And he was the father of biomedical treatment, where we know there's a medical basis for autism. It's not bad parenting. So I learned more and more about it. I eventually needed to, by fire, help my son because no one else really would. And then I learned more and more about how to do it. And then we started helping other parents in the parents group we're in. They were helping us. We were helping them. And eventually it grew into a practice that I have now that's been going on for, 15 years now. And that's how it started.
And what, obviously we know with our kids, they drive us in so many ways, right? And so because of your son, look how many other children, thousands of children that you've been able to help now. But, what was your medical background prior to diving into the autism world?
I went to undergraduate and taught chemistry in the organic laboratory in Nebraska, and then I went to med school in Cleveland and graduated about 35 years ago. It seems like it wasn't that long ago, but I guess it is. And then
Time flies.
It sure does. It flies fast. It seems like it's gone faster since our son got sick, because you always want more time to help.
Yeah.
But I did training in several areas. I've always been a big believer in that, and a lot of it was pediatric, and a lot of it was in neurology and brain function and maternal and children's growth before and after pregnancy. I was mentored by a wonderful doctor who was from Pakistan. He was terrific, and he mentored me with obstetrics and gynecology and high-risk pregnancy. The first time I met him, he was delivering triplets by cesarean section after having helped a couple with fertility issues, and then they got to have complications during the pregnancy, meaning they needed the triplets delivered, and that's how I first found him, and I helped him in the surgery. And after that, I just kind of followed him around, and he took me under his wing, and I learned a lot from him and about women's reproductive health and about a number of things about drugs and toxins during pregnancy, and that made me very interested in that topic before I was ever married, before I ever had a son. And then I went on to do toxicology as an emergency medical doctor. I trained still in Cleveland, did a lot of work in that area, and I was kind of the nerd who wanted to know about chronic toxicity too, not just what would come in by ambulance to an ER, but about things that took a long time to build up. And in Cleveland, we have a lot of industry, and sometimes there are things like lead and radiation and things of that nature. And most of my colleagues in the ERs never really had an interest, and they didn't have that many cases of that, but I was very interested in preparing our residents for it. So long-term toxicity, and then food and herbal toxicity, I thought, and use of herbals was very important because that was new when I was starting out, and the medical profession wasn't really used to that. So I thought our residents and I needed to know about it, and so I got into things like grain chemistry. And when it got into grain with a G, grain chemistry, I studied gluten. And before I ever knew I was going to apply this to my own son with a gluten-free diet and the neurotoxicity of gluten and the GI toxicity of it and the immune toxicity, I was just lucky. You know, it was sad that our son regressed, but I feel fortunate that I happened to have those backgrounds because it wasn't hard to take the next jump to the next level. And when we couldn't find anyone else to help him, I learned from several others in pockets, and I really, put it together in the way our practice is. And there are a handful of practices out there, still not enough, from coast to coast, probably about 20 big practices and groups of people who are trying to do this for people who have autism and developmental issues like Asperger's and ADHD and OCD, and it applies to them. And I was just fortunate to know about the toxicities of drugs and mercury and things, along with food from a nutritional and toxic standpoint, and how brain chemistry works and how things happen from before, during, and after pregnancy, and it just all came together to help our son. And it's and then we've been able to try to offer what we can to other people that way.
It's fascinating how life has a plan for us before we even knew what that plan was, right?
Yeah.
It's like all the dots are being connected now. Now let's jump into, what the topic is, which is Lyme disease. What is Lyme disease? For those out there that, most of us think it's a tick that bites you and maybe it goes away after a little bit of time and maybe it doesn't. I've heard so many different things, and the general public, I think, has a totally false idea of really what Lyme disease is. So can you give those people listening who really don't understand, kind of what the basics are?
Yeah, I mean, there are people who get the overt, rapid, outward Lyme infection. So Lyme is named after Lyme, Connecticut. We actually have patients from Lyme and Old Lyme, Connecticut, the two towns there where it was discovered and named after. We have some patients in that area in Connecticut. And it was named that way, and it was frankly, and without trying to sound harsh, it was a blunder of doctors. It was a mistake that doctors made, and the parents who were bumping into each other, who were seeing each other at the neurologist's office with their children, who were seeing each other at the physical therapist's office and the rheumatologist's office and the drugstore to pick up their pain medicine and their anti-arthritis, anti-inflammatory pills, with their sickly children with their knobby joints and their skinny muscles and wasting away and getting sick on prednisone and all kinds of other medications. They've said to each other, don't I know you from over there? Aren't you over there? Oh, well, yeah, my kid's 5 years old and got, seronegative juvenile rheumatoid arthritis. Now it's got several names like idiopathic inflammatory arthritis and things of that nature, but it's the same thing. And they're all diagnosed as having juvenile rheumatoid arthritis without all the classic findings that the doctors were sure of it. Well, the mothers thought something was strange, and that was the conglomerate of happening around the same age, around the same time of year, mostly the midsummer, the late summer, and the early fall. They're all within most of them were about, as little as a street or two away from each other, some just a few blocks away, but they're all pretty much in the same 3 to 5 mile radius, kind of straddling two towns, and they thought it was either a toxin or an infection. That's what they thought. So they went from one doctor to the next, and they were told they were crazy, they were overbearing, they were denying, they just didn't know. We're the doctors, you guys don't know. And finally they came across Alan Steer, who's a pediatric rheumatologist, who at the time was at Yale. I think he's moved to Harvard now. So he thought that it was a virus, and he tried to work on that model. But between some further information from the parents and some other things on the work that he did, he eventually thought it might be one infection or another, or something in the bush that was an infection, maybe bug-borne, maybe not. And he called a person named William Bergdorfer, who just passed away, really, in the last recent time period, who everyone likes. He was, on everybody's good side apparently. He was a researcher. He came to this country to research spirochetes, certain type of bacteria. And he looked at some things, and he asked for and had seen some tissue specimens that he reanalyzed, and he saw the Lyme germ there. And it was in the family of the germs that he was looking at. And he thought this was a chronic infection. And so at that point, the discovery was made that the doctors had missed this infection. It had been smoldering for years in many children. They were getting joint damage, and some of them had severe heart problems, which didn't make sense for rheumatoid arthritis. One of the reasons the mothers didn't buy it. And some of them had brain dysfunction, and that just is not what you see in the vast majority, if any, of the cases of juvenile rheumatoid arthritis. So the bottom line is that they started to use antibiotics for it. And antibiotics aren't perfect, and many of us know our kids with spectrum problems have gotten worse, and they've gotten messed up GI tracts, if I could be vernacular, with antibiotics and steroids and all these different things. But many of those kids got better, and their joints got better, and their heart problems got better, and so on and so forth. So the bottom line is it was missed by doctors, and the family members knew something was wrong, and they went on an odyssey to get diagnosed and to get some help. And unfortunately, it's still that story a lot of the time, not all the time, but a lot of the time today. Slowly, it's somewhat making a little turn. But adults and children with Lyme often don't ever recall or know or see a tick bite, even though that's what the medical books will tell you, and that's what most people are taught in medical school. You can't have Lyme unless you recall a tick bite. Well, where it ever came from that you had to recall it is sort of that's a medical mistake right there, and I just have to say it. Our profession's not perfect, and that's one of the biggest mistakes in the most recent 30 years or so, that if there's a disease that can be caused by a tick bite, why would the patient be forced to meet the criteria of recalling it, And so people don't recall when they've been exposed to a poison. So if you go to a restaurant, you eat something, and you start vomiting and feeling sick and having abdominal pain, you go to the ER, you don't have to recall that somebody put a toxin or know that somebody put a toxin in your food. It's just that you find out afterwards when you develop symptoms, and then you and the doctor together really figure it out. So there's still a lot of denial and refusal, and to this day, from where I'm speaking in Ohio, there are a lot of doctors who, unfortunately, and at the very least, I very deeply disagree with them, that the parents are told that they cannot get Lyme disease in Ohio, can't get it in Ohio. Well, you can. I mean, it's in the animals get it. The animals get bitten by ticks in Ohio, and they get it. So that would mean we're the only vertebrate animals that can't get it. Every vertebrate animal can get it. Snakes, birds, raccoons, skunks, deer, mice, they can all get it. And they can pass it along congenitally. We often get the bullseye rash, which is red around the outside and white with one or two little rings on the inside and sometimes a little purple dot. But if that happens in your scalp or between your butt crack, if I can just be vernacular, or if it happens under your arm, or if it happens on your back, or if it happens under the nape of your neck, especially if you have long hair back there, you're not going to see it. And the fact that the ticks can inject anesthetic into the skin when they're there for up to 2 weeks, you may not feel a thing. And some people feel it and some people don't. Some people see it, some don't. But we'll get a story where somebody went whitewater rafting with their kids, and then one or more family members come down with a mysterious feverish illness. They start to decline, and often they don't have the joint pains, they don't have heart problems, thank goodness, but they vaguely feel seriously ill. And they get every test known to man. They see every doctor of every type I've ever heard of and 10 other ones I've never heard of. And they get all kinds of tests. And with sincere, good testing, they don't have anything the doctors detect. And we used to say we could diagnose seronegative Lyme by diagnosis of exclusion. Now that's you practically get blackballed if you think that way as a doctor now. And the tests are not perfect. It's and we can talk about that. But the ideal case of a tick that you see that bit you, and then a week later you get a bullseye rash, then you start getting heart and joint problems, just doesn't happen with most people. So it's hard to diagnose from that standpoint.
Now, what does it have to do with the development of disorders like autism, though? Because it seems like we're seeing so many crossover with autism and Lyme disease today.
We are. I think that sometimes autism can be caused or brought out by Lyme. sometimes Lyme is more likely to happen in an autistic person with the weak immune systems that our children with spectrum disorders have. You know, a lot of the kids with ADHD have asthma. That's not a coincidence. Their immune systems make it inflamed in their lungs when they eat a certain food or get exposed to mold or when their pollen counts are up. Not everybody wheezes with that, but the ADHD kid, along with the asthmatic child, has a much higher rate of getting wheezing when that occurs. So the immune system does not work as well as anywhere near as well as it should in the autistic child. And so if everybody in the family gets bitten by a tick when they go camping under some tents out in, some bush area in Ohio or West Virginia or Connecticut or Montana or the more woody and shaded parts of New Mexico or Texas or California. Even the Caribbean, we have people who vacation there, and that's when they get their tick bites and so on. And they've either seen the tick or it's known to happen there, and they get sick. And so when we get the story of this description, and then we see that the spectrum kid in the family is the one that got sick, and either their autism got worse, which is one way Lyme can affect you, we know that's true, or they come out with an illness with maybe joint pains and some other things that are characteristic for Lyme, and they get developmental problems. And we've had kids become dyslexic, ADHD-ish, lose speech, regress, especially the little ones when they're under 5. They're still underdeveloping, and meaning they're still sustaining what should be their normal, happy, productive development and making gains. Then they'll either hit a wall or go down, and they get physically ill with Lyme at the same time. So we've seen this, and it does happen.
And so what leads you to suspect it's Lyme? Because I know often people will get a Lyme test and it will say negative, right? But that doesn't necessarily mean that, right?
That's right. We sometimes will even see that a sincere, well-intended person, sometimes people who are deemed to have high levels of expertise, and they do in many things with infections and so on, the parent will come and say, we went camping, we saw ticks on all the kids, we had to pluck them off several times a day, and this kid got a bullseye rash, and now he's got developmental problems, feverishness, and he walks like a person with bends where they're kind of bent with their knees out, and they look like a cowboy at a rodeo that just got off the horse that got sprung, and they really kind of walk, bow-legged, and because they hurt in their knees and their hips. And their jaw joints hurt because we have joints up there too, and they don't want to chew their food. And they lean forward and they let their neck stay forward because when they straighten up and move it around and look around, it hurts. And there's all those joints there. And so they can get chest pains along the side of their sternum, right, to the 3 inches to the right of the middle of the chest, where we have almost like a rosary bead of vertical joints with one ribbon after the other where it meets the sternal bone. And all these joints hurt. And the kids can have heart problems. I mean, what makes a little 4-year-old pass out after they go on a camping trip? I mean, that's a real scenario that makes you worry that they have Lyme carditis, the heart problem. In Lyme, most people who get heart problems from Lyme are young people, certainly under 30, but the teenagers and the school-age children and the toddlers are the ones that can get the worst heart problems. And it's awful. Then there's things like Bell's palsy, where the one side of the face sags, but it's not a stroke from the inside of the head. It's the nerve that controls the facial muscles that won't work. And when a child gets a Bell's palsy, you really have to prove that it's something else other than Lyme, because that's the number one cause in a child that age. So there are many cases where you're not going to see a tick and you're not going to see a bullseye rash, that things show, especially in a young child, that the number one cause of those would be Lyme, even if you don't have the obvious things like a tick bite and so on. And sometimes we've seen where the kids have a rash and a tick bite, then they develop a Bell's palsy, and again, they're told that it's not Lyme because it doesn't have a positive test. Well, the test is a weak test. It's one of the weakest tests we do, that and the Bartonella germ, the cat scratch germ. Those are the 2 weakest blood counts we have for picking up the germ when it's there. The germ can be there and they can miss it. It's the opposite of strep culture. Strep culture, I have a family of 5 right now, and they're all carriers, and they all have a positive strep test. And because strep is out in the open, it's greedy, it loves to grow, and all you have to do is take a swab and feed it, and it'll show up on the test for you virtually 100% of the time. And if it doesn't show up, it's virtually 100% sure that it's not there. Lyme is the opposite of that. There are many, first of all, it won't grow in a culture for the vast majority of people, and it's very difficult to detect. That's why it's so hard to treat. That's why it's successful. It's learned to evade detection, and it's a germ that lives inside the cells, and the immune system has a hard time with it. Then the immune system knows something's wrong over there in the liver or the heart or the nerve or the joint, and it attacks that, and then the person gets sick in those areas. And when your joints hurt and you can't walk, and when you have sickness and infection through your body for weeks and weeks and months, and you're a 4-year-old, your body's going to get sick and weak, your muscles will shrink, your knees get knobby and swollen and red and tender, and you cry at night because your legs hurt, and your knees hurt, and your hips hurt, and your back hurts, and your neck hurts. And you don't want to go play and run with the other kids, and you lose your appetite. And if it's affecting you cognitively, it can cause spectrum issues, regression, and cognitive dysfunction, delays, lack of forward progress, simply leveling off. It doesn't always have to be regression. And we've never had good blood counts for this. They're not good. We have to use antibody tests to see if the immune system has gotten a clear look at the Lyme germ and has identified it with antibodies in the bloodstream. And they don't always do that either. And it's highly variable from one lab to the next. So we suspect it in somebody who has some exposure to the certain type of territory geographically, which is really not just in the woods and not just whitewater rafting. Even in areas like New York, we have patients from the city of New York where there's a lot of concrete around and very little trees. The issue with that is Central Park's a big area there. They have birds there, and the birds can go fly to the few trees here and there throughout Manhattan. And if you're under a tree at a small little park setting, or you have a little patch of grass, even on top of some of these high-end buildings, the birds will come with little trees, and they'll drop ticks off, and the ticks seek people. And they go after people and pets. That's their favorite targets. And they attack people. That's what they do. And birds fly all over, and birds have ways of dropping ticks off, and so it goes. And that's how our exposures are, whether it's a big city or a park or a rural area. Sure, the rural areas are more likely in the suburban backyard on a quarter-acre lot with some shade trees and some critters running around like deer every once in a while and wild birds and woodchucks and things of that nature are going to bring more of those into the yard. And then your child sits in some grass that's a couple inches deep, and they sense the warm body, and they smell our exhaled carbon dioxide. And they have all day to crawl around, and there's thousands of them every square, area in the yard. And the baby skin is very soft, and they seek these warm little dark areas because they don't like the sunlight. And a lot of parents will see these ticks attached or otherwise inside the diaper. If they're very small, they can crawl underneath. They're very light-footed. And we know when those kind of exposures are happening that sometimes people get bites. And you don't know if the tick's bitten your child and then reversed its jaw bite and started crawling somewhere else. We don't know. I mean, they don't give us a record. We don't have a spy camera there. So many of the kids that seem to get sick as they start to walk and talk may have just the joint problems, and they don't have a developmental issue, but they get ill. They get unexplained fevers. They stop eating. They start losing weight. And they do hit a wall developmentally. So we either suspect it in a child who's not autistic but starts to get physically ill with some symptoms that are best explained by Lyme, and you have to do tests to make sure it's not something else. You do want to look and see if it's some other disease, and there are a number of joint diseases that happen in children, and sometimes terrible things like leukemia can affect your joints. And when you do a few simple tests and you do a couple x-rays and some simple things that are pretty simple, and by that time most of the rheumatologists, even if they're kind of tough about this Lyme issue, because many of them disagree that Lyme is as common as it is, then they've done really a service. I often tell the parents, I know that you may have had a tough time with Dr. XYZ, but they've done what they do best, and that's to rule out things like brain tumors and things like serious eye disorders and things that have these so-called autoimmune neuropathies and Kawasaki's disease and all these different illnesses that are out there, and congenital heart disease with late presentations and so on. And now we know you don't have those disorders, and the only test that has sort of a slight wisp of a finding is Lyme disease, and we ought to really go and look further. And so that's what we do. And there are many other tick-borne illnesses, and if a child has antibodies to 3 or 4 of those, I think that that's a simple intellectual process. They've been bitten by a tick. They don't have anything else. And the likelihood is that they have a tick-borne infection, and the most common one in this country is Lyme disease.
No, I've heard that it could be other than ticks, though, too. But then when I had a scare, we can call it scare, thinking that I potentially got bit by something and I wasn't sure if it was Lyme, you know, I'm in Southern California, and I went to the ER. And because my leg looked weird, and they said, well, you're nowhere near ticks, and you can only get Lyme disease from ticks. And I said, I read other places that you could potentially, like, it could be maybe from a spider. And they laughed at me. They were like, no, that's not true. And
that's unfortunate.
And they literally, like, I pulled up stuff, like, from the web, and they told me, like, not to look at those sites. That then they pulled up something from the CDC and said, this is the only place you can get it, and it's only from Lyme, only from ticks, and that's the only place you can get Lyme is from ticks. And it just made me feel like I was totally crazy, you know, being from our world and the autism world. I feel like we're far more advanced sometimes, right? Because you know, I'm sitting there trying to explain, you know, and then I basically forced them to test me for Lyme, and then I forced my regular doctor to test me for Lyme, you know, 1 month following, another month following, and you know, it wasn't that, but I wanted to make sure because it was so odd, the bite. So what other areas, like for example, I'm in Southern California. We don't have, you know, we don't have deer. Now you did say a bird could, just like New York, drop a tick, but is there anything else that we should be looking out for, like other than just the tick?
Yeah, well, as far as ticks go, they are all over Southern California. It's not as much as you'd get if you went to Northern California or to some of the slightly cooler areas into the hills, going away from the sea and all that. But I was there recently at the MAPS conference in the teaching role, and then I spent a little bit of time with a good friend of mine, and they took me around where they shot La La Land up by the observatory. And I looked down on the walking trails there, and there are clumps of trees there, and there are trails right along some of these areas of brush, and I'm sure there are ticks down there, and there are. The scientists have found them there. The natural resource people in the state of California found them there. They're not as prominent as they would be in an area that's a little bit moister and a little bit less up against patchy, dry areas. But it sure does happen. The other thing is, your point is very well taken. You can certainly show, we believe that it can be from other bugs. And it's not just the deer ticks, and it's not just the ixod ticks, they call them, IXOD. It's not just those. All ticks can have Lyme in them. The Rocky Mountain germ is present in the dog ticks, but the Rocky Mountain germ is present in the deer ticks. And then the dog ticks can also carry the Lyme germ. We've seen it from the Lone Star tick, which the female has the white dot on her back. They're usually about the size of your thumbnail. They're kind of flat and wide, either brown or gray. But in the southern U.S., we've had people get Lyme from, we know they've gotten, this is the only thing that makes sense, they've gotten bitten by fire ants or sandflies. We have one gentleman from the state of New York who's been inside homes and had several bites from being inside homes. And when he goes from one home to another and visits his friends and his family, they put him in a room that's a guest room that they hardly ever use, and there's spider webs all over the place.
Oh, wow.
And you can make a spider get Lyme in the laboratory simply by putting a mouse in the cage. I'm not trying to be mean to animals or anything, but in the bush it happens all the time. So in experimental settings, you can take a mouse that you know has Lyme and put a spider that you know does not have Lyme in there. It bites the mouse. You take that spider out of that one cage and put it in the next cage to a mouse that does not have Lyme. Spider bites that second mouse, and the mouse sustains Lyme disease. You can make it happen, and you can show that if that occurs, and in quiet parts of homes and areas where a lot of forest is around and trees and things, what house doesn't have exposure to mice? And if they get in and the spiders are there, they can intermingle. And mosquitoes probably transmit it in some of the areas that border on cool areas, hills and mountains, along with areas that are lowland and some of the hotter regions. So some of the tick-borne illnesses in north of the Mexican-U.S. border, most notably the parasite Babesia, with a bee like boy, which is sort of a cousin. It's a cool weather version of malaria. And instead of being in mosquitoes in the U.S. and Canada, especially in New York, where Richard Horowitz is, whom I worked with. I had the privilege of training under him in the Hudson Valley between New York and Albany, the city of New York and Albany. The world's most endemic area for Babesia is there, and the ticks are the things that spread it. When you go toward the Mexican border and then you start going south, then there's a mingling of mosquitoes and ticks, meaning they're the two sources of Babesia. And as you go down toward the areas in central and southern Mexico where you start to see some malaria, and toward Central America, Babesia can be present in mosquitoes and in ticks. You go up in the mountains, it's in ticks. You go down to the plush tropical areas, it's in mosquitoes. And it's much more like malaria there, and it looks like it under the microscope. They're cousins of each other. So there are many bugs. You can, again, do these experiments in the laboratory and quote-unquote show. It's not making, it's showing that these bugs will bite, sting, or interact with the animal that has the Lyme and spread it to the next animal in another area of the laboratory that does not have Lyme. And it can be transmitted that way.
Now, I like that people can hear about that because, honestly, like I told you, my experience in the ER, they looked at me like I was nuts. And I just, I stood my ground, and I was very, matter of fact that, I didn't agree with what they, what they believed, and they didn't have to agree with what I believed, but we were going to do the test one way or the other. And so I think it's important for parents to hear that, because if you're hearing the symptoms that Dr. DeMio is talking about, it's important. Often we think, oh, there's no deer by my house, or I don't know much about Lyme disease. If you hear these kind of symptoms that he was talking about, I think definitely go find a provider or a doctor to at least test for that. Now, what kind of treatments do we go for, and what results are we seeing, good or bad, with these Lyme treatments?
Yeah, well, we sometimes will see that child with autism whose autism got worse for no clear-cut reason after they went to the family reunion and they were running around with their cousins in the park or something like that. And 3 weeks later, they start to get worse, and they were making gains, and then their therapist thinks something's wrong, and maybe they have fevers, maybe they don't, maybe they have some very nondescript little pink rashes all over. And then we, go check them for a number of things, and the only thing that shows is one of the tick-borne illnesses. And maybe the test isn't 100% positive, but it's the only thing that has a little bit of noise on it, and it's the only thing that shows. And if we do several of those and we see that there's a higher likelihood of chronic infections, then we treat. And we do use antibiotics a lot of the time. Children who are preschoolers, though, sometimes we can do the treatment, and I don't want to say get away with because it's full treatment. We can do the treatment without antibiotics. And this is where we get into our category of congenital Lyme, because it can be transmitted congenitally and through nursing. We're convinced of that. The European doctors believe in it. There is disagreement out there as well, but there are several significant believers in our International Lyme Society, the ILADS group, of which, as you know, I'm a member. I'm on the board there, and we, have our annual conferences, and we have several conferences during the year, and we interact quite a bit every month. We have board meetings and lots of activities in between. And so we know there are many ways small children can get Lyme. Many of those kids have milder cases, and we treat them with diet, herbs, and probiotics, and that's what we do. And many of them get better just with that, or we'll only use a brief course of antibiotics with them. But for the average person with Lyme, by the time they come to somebody like me, they unfortunately may have been told that this isn't Lyme, that the test has to be 100% 4+ positive, with 4 out of 4 being the maximum you could get, or else it's not Lyme, because that's what we're taught in medical school now, and we're taught that if it doesn't fit it in a pigeonhole, it isn't Lyme. And then so that means when you say that to patients, somebody's going to get missed. If you tell patients, well, your EKG doesn't show a heart attack, and you don't have classic chest pain like an elephant standing on your chest, and you don't have diabetes and high blood pressure, and you don't have 3 people in your family that died of heart attacks early in life, so you can't have a heart attack. Well, we know we're going to send some people home from the ER, and they're not going to survive because we'll miss a lot of heart attacks that way. So it goes with Lyme. And so when we see a patient, by the time they come to somebody like myself, although we see the acute cases, because people who know about us will call right away if they think they might have just been exposed to Lyme and gotten Lyme. But when we see the chronic cases, then for a lot of people, especially when they're above, the early school age and teenagers and adults, they need antibiotics. And for those of us from the autism world, we saw what happened that was so negative with our kids with antibiotics, and their GI tracts got yeast and got torn up. Then we go with our old friends probiotics, and we use the good guy yeasts like Saccharomyces and like home fermented sauerkrauts that you've taught people about for many years with things like the body ecology diet and so on, where the live yeast like good bacteria and yeast will grow in the GI tract, and they don't get killed easily by antibiotics, and they help us use the antibiotics. So we use antibiotics often 2 or more at a time, and sometimes we rotate them, and we want results. And so most of our patients will get some results. Now, it's a tough situation. Some patients get worse with antibiotics because we're killing the germs, and we get what we know in the autism world, we get it in the Lyme world, die-off. And the nickname in the Lyme world is the Herxheimer reaction, which I think a lot of people use in the autism world too. Sometimes that means the symptoms get worse before they get better. And if it's tolerable, we do that in my book, for up to 2 weeks. But if people are not getting better after 2 weeks, we either change the antibiotics or we switch them out for herbals only, or we do a rotation, herbals versus antibiotics. We do use hyperbaric. The germs do not like to have a floodlight of oxygen put on them because the immune system and the cells in our bodies get healthier and can fight the germs better. And it sure isn't perfect because this is a very bad actor infection deep inside the tissues. Many of our patients get a lot of improvement, sometimes slow, sometimes quicker, and we've had some people turn right around within 3 or 4 weeks. And that's the tricky case because you've got to keep people on some treatment so they build a war chest. And others, it's slow over a year sometimes, 8 months, a year, year and a half. And they get IVs that they carry with them that get installed to them sometimes. And it's not everybody. So the more severe person gets the IV antibiotics for up to 8 months, sometimes longer, and they get slow and steady improvement with some ups and downs in a zigzag fashion sometimes. It's a challenge. It's a lot like trying to recover somebody from autism in the sense that it's not, the mainstream thought. Most people are discouraging patients from getting these kinds of treatments, but many of our patients get a lot better. And that's the key. That's the way we look at this. We know we're on the right track as doctors when the patients are improving. When they improve with what we're doing because we're aiming at Lyme, to me that clinches the diagnosis. And that's
now, you talk about getting better. Can it ever be cured?
Well, that's the big argument at our discussion. I don't want to make it seem like everyone's catfighting. The big discussion at our Lyme conference, where thousands of doctors, patients, and scientists, practicing physicians, and intelligent people, and over the years have come to our conferences, and they have the clear-cut belief and sense that this is treated properly with the treatments, including antibiotics and herbals and immune support and GI support and all of the things that we need to do. And we do neurologic support with things like GABA and theanine and hyperbaric oxygen. And I'm in the minority in the group because I think we do cure some people, not everybody, but some people. We first want to do what we do just like in the world of autism. And if autism is worsening because of Lyme, then that's our barometric little marker that things get better for the autistic child because their spectrum problem may stabilize and or improve. We've heard of adults with Alzheimer's and dementias that have been diagnosed by doctors, and somebody thinks maybe it's really not Alzheimer's disease or something like that. It's Lyme. Well, if that's the case, you want to see that improve. We've had patients with MS, and it's not everybody, and Parkinsonism, and it's not everybody, but some of those patients have gotten tremendous improvement when we do Lyme treatment. And they're doctors with good intent, but with sometimes some anger, which I don't think is professional, have told the patients don't go to some quack that tells you that Parkinsonism is caused by Lyme. I'd say about half the time with some of these things that are like Parkinsonism, we have found that we get improvement when we find that it's Lyme. It's not everybody, but when we really do our very best to try to determine what's causing the problems, we can see improvements. So that's what we want to do. And so I would say most people get improvements, but that's with a plan where I, as a doctor, have to be willing to back off if they're not getting better in the first few weeks, either change the treatment to some different antibiotic, different probiotics, or back off of the antibiotics and use some non-antibiotic treatments. And we've used some cases, some regimens of antibiotics that are either seeming to others are extremely high, and they're not extremely high. They're just giving a full dose so we can get deep inside those tissues, into the bones, into the solid parts of things like the liver and the muscles and the tendons, which don't soak up antibiotics real good. I mean, you've got to give high doses when you do that. And we use oral doses for people who tolerate them that are much higher than we usually would because we want to make them similar to IV antibiotics. Some people don't want IV antibiotics. They simply don't want shots, and they don't want hardware hanging out of their bodies and getting IVs and things of that nature. So they are willing to go to high doses of oral antibiotics. And for those patients who can tolerate those, we've had success, and I think we have cured some people as old as 60, 70 years old, because when we stop the antibiotics and we back off of everything except clean living with a good diet and some basic herbals, and we continue the probiotics, they don't have any signs of Lyme. They never look back, and we've had them out past 5 years where they feel great. And they haven't been on any antibiotics for anything for years. They usually have to be very strict about eating very clean food, not just organic, but, prepared without added junk, without a lot of sugar, some people don't ever eat sugar anymore. And many of the people are convinced that they've gone even further than what I've asked them to do with strict diets. They're very convinced that that has maintained their ability to not have relapses of symptoms. So overtly, it seems that we do cure some people, and it tends to be people, again, under 30, more so in the teenage population, and especially in the preschoolers, particularly if they seem like they're congenital Lyme. For some reason, that seems mild, or at least it's easier to treat. When I think it's congenital Lyme, it seems to respond better. And if we do use antibiotics in those kids, it's much briefer than anyone else, 3 months or less, which is, I think, less than a lot of the patients we treat. And they do get better. And I think the little ones are the ones we cure the most frequently. And again, it's not all of them either. Sometimes we get calls that some of the symptoms have recurred, particularly the eyes and the face, when they start having inability to look without being cross-eyed and the face doesn't move and has that Bell's palsy that I mentioned. If that recurs, we've got to get them. The first thing I do is put them back on herbals and a clean diet, and then we decide whether or not we're going to go with antibiotics again.
It's interesting that they're so worried to say the word cure, but yet if you don't have symptoms of cancer for 5 years, you're cancer-free. So at the very least, it would seem that you'd be Lyme-free, right? If you don't have, if you have no symptoms. Now, can a Lyme be passed from mother to child, or even from mother to father?
It can, and it's not an STD. Unfortunately, that term's been used. But just like you can have a cold and kiss your Aunt Millie when you're going into church or the synagogue and pass it along to her, that's not an STD. And if, you've got, let's say a man or woman has yeast infection, either like a jock itch or a vaginal yeast infection, or the man's got the yeast infection from the gym or whatever, and you're romantic with your mate, then you can pass that along. That's not an STD. It's just something that you can inoculate that way. And so it can be passed between partners, and either the mother or the father, we're very convinced of this, can pass it along to the baby. And yes, the father can as well. They may only contribute one cell, but if that one cell has Lyme writing on its back, then it's a perfect arrow for the very center of where reproduction happens when the mother and father cell comes together. And that germ loves to live inside cells, and if it reproduces or holds its breath or hibernates till it's a good time for it to reproduce, it's going to do that. And we do see kids who seem sickly from the start. We know this happens with the tick-borne illness that I mentioned before, Babesia. We know that blood transfusions can cause cases of Babesia, and because it comes from one person to another. We've detected the Lyme germ alive and kicking in breast milk. So these germs are very bad actors, and we know in ticks, some of the quote-unquote newer strains to be discovered, the relapsing fever strains and so on of the Borrelia, it's in the same family, it's another form of Lyme, that the ticks don't have to bite another creature and suck the Lyme into their mouth parts. The mother tick can pass it along through her ovaries to her offspring. And they're born right out of the starting gate with Lyme. So there are many ways that
it's crazy that we're not talking
scary.
about this more. You know what I mean? Like,
Yeah.
it seems like people should learn more and hear this more. Like there's no risks of doing the Lyme treatment, is there? Like, what are they so afraid to talk about?
Well, antibiotics can have risks to them. I'm not denying that at all. But we do get people in my neck of the woods, meaning what I do, unfortunately, are in a smaller group than the big self-appointed, self-proclaimed leaders and decision makers in the world of medicine. And, with the shakedown in Washington, we might see some changes with that. I have no idea. I mean, I'm well hopeful that vaccine moderation and parents' rights are going to get respected more. I hope that will happen. I would love for that to happen. I'd love to be part of all of us to see that, in other words. And so it goes with Lyme. I mean, I think we've heard things from some of the more open-minded government officials who seem to happen to some of them have Lyme in their families, too. We know President Bush has talked about it. There have been rumors about Mitt Romney's wife having it as her diagnosis of MS. And I'm not treating doctor for any of those people. I'm not trying to say that they have that, but we have people from all over the world that have Lyme, and they've gotten it in an area that has shade, foliage, and it's not bone dry and blistering hot. Anything that's a little cooler and more plush than that, it's there. And we've got, I think, our driest area is one of the edges in Turkey. We've had people in New Mexico, California, southern and northern, just about every state in the union. Hawaii in recent years has reported its first internal sustained case of Lyme. The panhandle and southern parts of Alaska have Lyme, and you can see the ticks there. You can find Lyme inside the ticks. It's all over Canada, and it's all over the United States. I think every state in the union's had cases of it. And Ohio is a big state. When you look on the CDC map, though, you see dark spots all over Pennsylvania, dark spots all over Michigan, and Ohio's white with a few spots on it. That's got to do, you can tell something like that's political or it's something that humans are disagreeing about, because either they're overcalling it in Pennsylvania, Michigan, or undercalling it in Ohio. I think it's the latter, and you can see that they miss, the cases at the CDC because they raise the bar for the criteria. Meanwhile, we're treating all these cases that respond as if they're Lyme, because they are. And so the risks are there with antibiotics, but when somebody has HIV and they have terrible infections and we want to treat them to make them better, there are risks to antiretroviral therapy. There's risks to antibiotics. If you're in a car accident, unfortunately, and you break a bone and the bone sticks out and you get a staph infection in your shin, which is a well-known entity, months and months and months of antibiotics, PICC lines, ports, home health care, multiple procedures, vascular access, all kinds of things. Yet when somebody like me comes along and does that for somebody, then we're told that it's over-treatment and it's unnecessary, and 3 weeks of amoxicillin at the lowest dose will cure Lyme every time. It doesn't cure Lyme.
How long is the treatment for Lyme typically?
Most people, it's more than 3 months, and I'd say it's generally past 5 months. Some people, and the reason I say that is because if you get lots better before the 3-month mark, we usually want some months, 8 to 12 weeks, where you're totally symptom-free, or basically you've maximized to close to 90 or 100% of normal, so that you build a war chest. And we all know that when you have strep throat and you go to the doctor and they give you 10 days of oral penicillin, they say to take all the medication. Even if you feel cured by day 3, you're supposed to finish it all the way out to a week. Why? Because the moment you feel no symptoms, that germ goes under the radar and it's getting killed ever more and more eliminated. But if you stop there and just drop your antibiotics, then that germ's remnants are going to grow back. And so we know that happens with things like pneumonia. We know it happens, with Lyme. So we go out. So my rule is usually about 3 months after you feel that you're maximized and basically you feel no symptoms. So if you're 5 months out, that's going to put you to closer to 8. Now, sometimes we adjust that if the antibiotics start to get your GI tract down. But we usually bridge that with some kind of strong herbals that are germ killers. We usually bridge that by keeping our probiotics going. We have very complete, basically for all intents and purposes, use for every patient of immune stabilizers like the curcumins, the naltrexones, sometimes IVIG. We have several patients with Lyme, and their immune treatment is IVIG, which is getting, as we all know, harder and harder to get insurance approval. And they don't believe that it's necessary for Lyme, because if they just have a short list of what you can use it for, they can deny the claims. But when we fight it and discuss it and try to stick up for our patients, then we sometimes are able to convince them, because it's very expensive. But some of our kids need that because they really don't do well without the support of the immune system. We can take a germ and try to kill it all day long, but if the immune system is not able to finish the job and cannot maintain the barriers, then that germ is really not going to be eliminated. And that's where we have this whole discussion of cures and not cures and things like that, which really means I've got to treat the immune system and the Lyme infection and the GI tract and the brain chemistry, and I need to do that with a variety of things that we have. We use all the tools that we can within reason that apply to any given patient. That's what we need to do, and Lyme's no exception.
What do you think the controversy, you talked about how in your area it doesn't show as much Lyme as potentially there is. What do you think the controversy, if any, is there about Lyme?
I don't know why doctors are hard-headed and unwilling to give up, and I'm not being critical as much as I'm just stating a fact. I mean, there's some really intense fighting among doctors. I think people need to know this is very controversial, and so sometimes you get that sense, and sometimes it's blatant, but sometimes you get that sense that the doctor's telling you you're crazy, or, oh, don't worry about it, there's no Lyme in Ohio. I don't know what that bullseye rash is, that thing, but there's no Lyme. If you were in Connecticut, I'd say it's Lyme disease, but in Ohio it's not. And you get that, and sometimes that is a sincere belief because the doctor's taught that. Well, the engineering students are taught that when you heat up a solid or a liquid to gas, it expands about 2,000 times. But they just believe that. They didn't ever discover it themselves or calculate it or whatever. A few of them do, but they just believe it because their professor told them. And if that's what their professor believes, then they're going to believe it and they're going to take it like gold. And unfortunately, there's just a lot of catfighting about these kinds of things. And some doctors are downright hateful, and they cling to what they say and think. And if they're in the position of power, some of them, you see, some of them are very, and we've seen this with the autism world, I know you know it's true, that there's just this clinging to the position of power and not wanting to give up the status quo, and that's not science. That's just being hard-headed. And then there are respectful doctors in a position of power that say, we really don't believe this is Lyme, but if you really have every reason to treat it, we're not going to stop you from doing it, and it's not like it's their prerogative to or not to stop somebody from treating it. But we need freedom, and this is not a free country. When I have patients who tell me they've tried to get their Lyme treated and they can't. So we have people who have a positive test at a conventional lab that's respected for telling you when there is or isn't Lyme, and they had a bullseye rash and a tick, and no one will treat them. No one will treat them. So Under Our Skin is a documentary that was made, Under Our Skin. If you look at that, the first case that the person presents himself. This park ranger in New York, in California, because the other guy's in New York. And the California park ranger had every sign of Lyme disease, had a history with a tick bite, bullseye rash, and a positive test. And they still wouldn't treat him because they said you can't get it in this part of California. He got very sick until he was treated. So, I mean, if that's what it takes to convince somebody, to me, that doctor has put up a giant brick wall bigger than the wall of China and decided they will not accept, virtually any case of Lyme disease as such. And the other part of the controversy is chronic versus acute, that there's no such thing as chronic Lyme disease. Well, if it didn't get diagnosed in the beginning, the germ isn't going to say, oh, well, I got 3 free weeks of not getting antibiotics. Now I'm done. I'll go somewhere else. It doesn't do that. And we've seen cases, if you look at Richard Horowitz's book, Why Can't I Get Better? That's the orange cover book, and he's come out with a green how-to book now recently. You'll see some cases of that, but if you look at Ken Liegner's book, Dr. Liegner, Liegner, also on the board at iLabs and a good friend of all of us, his whole book really revolves around one patient, and she was told again and again she can't have Lyme. Again and again it's not there. He showed them again and again during the whole slate of this lady's life, which eventually, unfortunately, led to her demise from Lyme. partly because she wasn't allowed treatment by the medical system and by insurance companies and so on, that eventually, even though he showed Lyme in her body several times, eventually, when she very sadly did not survive, her autopsy showed Lyme everywhere. Was everywhere.
Wow.
And it didn't show the classic findings on blood counts. It did intermittently show some signs of Lyme sometimes, but it shows you that these, and no one wants to hear that, meaning the establishment doesn't want that. They'll say, oh, that's a freak case. That's not the average case. That's not even really what happened. We've seen this with vaccine damage. We've seen this with Lyme disease. We've seen it with mercury toxicity. We've seen it with autoimmune encephalitis and vasculitis and neuropathy. We've seen this with several diseases that maybe it's just me and I, am respectfully willing to evaluate patients who have symptoms that other people are telling them they don't have, and other people are telling them that the white count of 22,000 and a platelet count of 67,000 and positive serology for 4 tick-borne illnesses and 6 viruses is all false positives. All of them, all 10 of them maybe, let's say. That'd be like getting 4 flat tires all at once as a coincidence, not because you ran over a bunch of, star-studded nails or whatever it is that they use for that, but that something funny happens, something very striking and very specific is happening. It's happening to a patient like that. It happens in our country, it happens in our society, and some people have Lyme disease, and they have chronic Lyme disease. And these are the big disagreements, with it. So when you're really sick and you can't function anymore and you can't think straight and you're 38 years old and your mother has to be with you at home, who's 75 or whatever, and she has to help you bathe and drive you up the street for groceries, that's pretty severe dysfunction. So the risks and the benefits, to me are pretty favorable in that setting to use not just antibiotics, but treatments like high-dose herbals and some anti-inflammatories and going to PICC lines and ports and things of that nature. Not everybody needs that intensive treatment, but some do. And I just really can't ignore a patient who tells me something's wrong. All the big-time disease tests are negative, and the only thing that shows is positive Lyme or a little antibody for one of the tick-borne illnesses and a little bit of activity on the Lyme test. It doesn't meet a full-blown positive, but the only thing it shows is that type of finding in the right setting. And when we treat somebody like that and they get better by treatment that's specific for Lyme, then we're very convinced that those are chronic Lyme cases where the test doesn't show.
Now, you mentioned, different ways of that it's, but how we might get it. Is there ways of preventing it, like potentially like a Lyme vaccine?
Well, there had been a Lyme vaccine, and unfortunately it mimicked a lot of the autoimmune inflammatory-inducing phenomena in patients. It did contain aluminum, which I think I would hope by now the drug industry would stop putting in vaccines. Back then, the controversy about aluminum wasn't as big as it is now. But we do have the history of that vaccine. We know it caused antibodies to be formed in people's bodies. Whether or not it helped prevent, it's got to have provided some protection. So vaccines may be in the forefront, and I hope if there is one that's made, they could, speak to those of us who treat thousands of people with this disorder, and we know how they got it in ways that we could all put our heads together. I would like to see that happen. I don't know, to my knowledge, none of us who have this experience. And I would just say with trying to stay humble, and I am, because I'm referring to my other esteemed colleagues in the same movement of chronic Lyme. It's very similar to the autism movement. I mean, rejected by mainstream society, things get missed by the mainstream doctors, and they have a very intense brick wall that they're just not going to allow the public to have access to these types of treatments. They don't want anyone to know about it. And most of the doctors who have those opinions are sincere, but it's not their right to tell public policy that there isn't another answer. It's really, they should be honest about it and say that there are doctors who treat this with some success, and at least they're reporting some success. We don't believe in it. We don't think it's proven, but you're the consumer. You're welcome to do it. So we need to have this type of thing go forward. We really do.
Now, we have learned so much during this talk. I mean, I feel like the listeners are probably just, to me, it's a wealth of information. Even from what I knew from Lyme, I feel like I've learned so much more. What are, if families that are listening, what are ways they can find you and your work and your clinic? I know you have a clinic. I know you also every now and then are working at the ER as well. I can't imagine how lucky those families would be if you're in the ER and my child has autism. That's one of my biggest fears in life is that I'd have to go to an ER and the doctor wouldn't understand. So, not only do you have a private practice, but you also are in the ER, correct?
I am. I was just there yesterday, and they brought in a 57-year-old man with Down syndrome. I'm sure he also had autism. He's totally nonverbal. It was assumed that he just, has one or two things that he'll let you do and not want you to do this and that. And I went in the room. I said hello to him. I looked him in the eye, and I told him what I was going to do. And his caregiver said he doesn't like to be touched. And he was rocking, looking forward, looking down. When I gave him his name, and I stopped. I said, I'm just going to stand here and tell you my name and say hi to everybody in the room. Then he looked up at me. I told him who I was. He knows who's the doctor. Meaning, like anybody else, he didn't want to go to the doctor. He's afraid he's going to get a shot. He doesn't want pain. He's scared that they're going to find out something bad and he's going to have to, go through a whole odyssey of treatment. Nobody wants that. And he's like the rest of us. Then I said, without being too much, because a lot of our kids and adults are very compassionate, I shined the light in the eyes of the aide there, which was another man that he liked. And I said, see, I didn't have to touch Doug. I just did this. So I need to do that for you. Can I go and do it on this eye first? And he let me do it. But as soon as I leaned on the cart, the bed, if you will, with my hands, he slowly, courteously took his hand and put it on my wrist and pushed my hand off because he doesn't like people in his space. And he just did it, courteously. He was aware of every single thing going on in that room. And so I was able to look in his eyes without, touching them or putting drops in or anything. You could see the redness, and basically had a bad case of pink eye, and I thought it was viral, but he had some crust in it in the morning, so we treated bacteria with some eye drops. Then I asked him and the caregiver what would be best. Would it be better if we put the first drops in, or do you want to go home? They wanted to go home, where they thought they'd get a lot more cooperativity. That's what we did. So it really is like any other patient. We listen to what they tell us, whether it's verbal or nonverbal. And so it goes with Lyme and autism in our offices, So we are in Cleveland and in Columbus. We see people from all over the country, and we just happen to be one of the practices. There are others. There's Dr.
Do you have a website?
Yeah, we do. We've got our website. It's DrDeMio.com, so DrDemio.com.
And I feel like the people are so lucky that I love that you have your private practice because, anybody can go there. But, when you go to the ER, you never know what doctor you're going to get, right? And I'm not saying anything negative about the other doctors, but for a mom or a dad out there that, I can't even imagine if I had to take my son and like a doctor like you, is so trained in autism, is so loving, so patient, and so understanding. I'm like, oh my gosh, what a blessing that would be. And so, I feel like the people today that are listening, it's such a blessing for them, and it's just always an honor, to talk to you. Do you have a final message you want to leave with parents that might feel a little bit lost, might feel a little bit hopeless? What do you want to tell them?
Yeah, I'd say that if there are doctors who are willing to help you that are sincere, and nurses and hospital personnel and clinic personnel that can help you, then you want to really connect with those people and work with them and ask them to help you. And if they're like anybody else, if they're really good, then they'll know that if they don't know, that they should help you to connect with people who do know. And so that's the only thing you can really ask of somebody. If they can help, they do it. If they can't, then they try to help you connect with somebody else who can. And so that's very important. And I would say if you're willing to go the extra mile, it's just a weird thing to have to go across town. Most people should be able to go up the street to their family doctor or go to one of the big hospital system satellites and just tell them that they're worried about Lyme and get a good answer. But unfortunately, you'll get a different answer from one place than you do from another, and that's just widely variable because the experience and frankly, the open-mindedness of just knowing a lot of the facts about Lyme and how it affects autism. Sometimes the autism is full-blown caused by Lyme. Other times it's made worse by Lyme. And like I mentioned, the immune system problems in autism. So what it really boils down to is follow what you think of your child or yourselves problems. If you think it's real and it's medical, don't give up and don't stand for or hear or allow anyone else to tell you that it's not medical and that there's nothing wrong.
Well, thank you so much, Dr. DeMio, for taking the time. I know how busy your schedule is, and not only do you talk the talk, but you walk the walk. You're a parent just like us, and, just trying to find the answers out. And your entire history is just so fascinating, and everything led you to be exactly where you are, today. And I just can't thank you enough for all you do for the parents and all the kiddos out there of any age. And if people want to find Dr. DeMio, can you give your website one more time? It's just drdemio.com, correct?
Yeah, it's DRDEMIO.com. Mm-hmm.
Perfect. And again, thank you so much for everything. We really appreciate it.
Thanks, Kristen, for what you do through Autism Hope Alliance and just what you do as a parent and as a fellow human being. You tell everybody else what you've, kind of gotten from this in a way that can help them. And you've helped thousands of people, and they're seeing you in action. So it's great to talk to you. Thank you for having me.
And thank you all for listening.